Hi, everybody. I'm Gretchen Yax, a Burst Ambassador dental hygienist, and welcome to Burst TV. Today, Rachel and Melanie are going to talk with us about treating seniors in our practice. So, if y'all can, if Rachel, if you can introduce yourself first and just tell us what you do and what kind of dental hygienist you are.
I'm Rachel Norwood. I've been a dental hygienist for about 17 years. And right now, I actually don't work in a practice on a daily basis. I basically serve as a temp. And so I live in East Texas. So I kind of travel around when someone has a need. And I guess my favorite is working in family practices, but I work in all different kinds. I like serving special populations. So I like working with the elderly and with children. So.
Melanie, what about you?
Hi, I'm Melanie. I am a registered dental hygienist in alternative practice in California. I work full time in a hospital setting where I serve veterans, and I also have my own dental hygiene practice where I go mobily to patients' homes and senior citizen facilities.
So, Melanie, is there anything specific that motivated you to want to work with the senior population?
So after we came back to work from the pandemic, when dental offices started opening up again, I saw a lot of senior patients not wanting to come and get their teeth cleaned or come out to hospital settings. I think they were just scared of the pandemic and getting sick and such. So I feel like doing the mobile practice and having them in a safe setting in their own home in a clean area that's safe for them, that's comfortable for them, really help them with this problem that they had and this lack of dental care. So that's what wanted me to become a dental hygienist in alternative practice. Just being able to serve this community, the underserved and the geriatrics that don't have a ride to the dental office or couldn't get up the stairs to go there or didn't want to bother their family or caregiver to change them and transfer them into wheelchair and bring them to the office. That's what really want me to work with this type of population.
I'm glad you do. Rachel, any favorite story about seeing senior patients or any specific senior patient?
To be honest, when I first started in dentistry, senior patients were not my favorite because let's face it, they can be more demanding and they live more years, so they have more stuff going on. And I thought they were harder to see. However, fast forward, several years into my career, I lost my grandfather to Alzheimer's. And after going through that and seeing what it was like visiting him in a facility and him not really knowing who I was and being confused, um, gave me a heart for for working with seniors and making that environment better for them. And so I started my own brain and body fitness company. So I started going out and doing that. Part-time and working in dentistry still part-time. And I think just from spending so much time with seniors during my day-to-day, it made me love my senior patients even more, and I had a special heart for them. And now I always enjoy spending time with seniors in any environment
I love that your face lights up when you talk about them.
because I love them. And I mean, I feel like it's a calling for me that I want to help them out because I hope one day when I'm a senior, someone's going to do that for me.
Well, good. So, I just want to have a conversation about what are some things that you do differently for our senior population. What are some things that others don't think about when seeing senior patients?
A friendly environment, calming environment. I'd suggest try not to schedule their appointments at the busiest times when there's a lot of patients coming in and out. A lot of the times they have a hard time hearing or they wear hearing aids and all the extra background noises interferes with your conversation with them. So they have a hard time understanding what you're saying and listening to the treatment that you're providing for them. Also, an operatory that has little clutter because a lot of times they look for a stable countertop or a stable table that they can hold on to transfer to the dental chair. So having a lot of oral hygiene products or things on the countertop makes it difficult for them to find that stability to transfer to the chair. So just a sterile, clean, um, minimal kind of environment is great.
Great ideas. What any thoughts for you, Rachel? Any specifics?
Yeah, I love what she said. I agree with all of it. I think, we don't always get to pick in our practice what it looks like. So some of the older practices have like a maze trying to find, show them where the operatory is or where the bathroom is. So I think the straight hallways that are clearly marked are a lot easier for them and for all of us. I think for some patients that might be suffering from dementia, it's really helpful if the bathroom is marked with the word like, women or men, and or it says restroom rather than just a symbol, because that can be confusing for them. I think with some older practices that still have that cuspidor, the little sink that you can spit in, some of them I've seen have it attached to the chair. They don't use it anymore, but it's there and they'll cover it with like plastic. That's confusing for a patient who all their life coming to the dentist has been spitting in that cuspidor, and now we don't want them to, but it's right there in front of them. So I think you should definitely remove that. Don't leave it even covered in plastic, because that's confusing. Um, I think neck pillows are a nice touch because a lot of them have issues and in the neck and back, and it makes them more comfortable. And I think when you can arrange your room where a wheelchair can fit in next to your operatory chair, it makes it so much easier when you have a patient that's trying to transfer that can get out of the wheelchair to the chair, but they have to have enough space to do it. So those are things that I think of.
Yeah. And wheelchair walkers, they need to be, it's, sometimes they want to go straight in, sometimes they want to back in. So even a place to turn around.
Mm-hmm.
Yeah. I almost feel like we need a lesson in wheelchairs, especially the motorized ones, because they all work so differently. But sometimes once they get into the chair, we need to get the chair out.
Yes.
Yeah.
So,
Yeah, I need a
yeah.
driver's license for that. They're complicated. Special
Right.
license.
Something else I noticed, speaking of chairs, is in a waiting room, you know, obviously having a lot of room for wheelchairs and walkers to walk in. But I see older patients struggle getting out of chairs that don't have arms on the chairs. And I
Mm.
never thought about that until I worked in an office that didn't have arms on the chairs, and it was very difficult for them. But like you said, Melanie, not having stuff on the counter because they want to put their stuff down, just anything to make it easier for them.
Yeah, simplicity is key for them.
For sure. Yeah. What about, do y'all have any thoughts on how you speak to them? Do y'all speak to them differently than you'd speak to anyone else? Any tips or tricks or any things that y'all think that we shouldn't do that we might do, like yelling at them?
I think it's really important to seem respectful of your elders, because I think they expect that from you. So sometimes if I work in a practice where we usually use their first name, I might address them by their last name if it's one I can pronounce. um, I think if I have music in my room, I try to keep it maybe a little quieter so they don't feel overwhelmed by that. And I think it's really important. I don't know why people do this, but sometimes they talk down to seniors like they're children. And that is so offensive to someone who has served their years, right, as a younger person. And now they deserve the respect that they've earned by the age that they've reached. So I think you just got to talk to people with respect, all people, but especially your elders.
Melanie, any tips? You had mentioned, patients with dementia or Alzheimer's. Do you have any? I feel like we're seeing a lot more of that in general practice. Do you have any tips or suggestions on how to help the experience go along for their treatment?
I think speaking slowly and with a loud voice helps a lot. And also speaking in front of them. A lot of times I catch myself laying them back and then sitting at the 12 o'clock position and I start talking to them. But it's really hard for them to hear you, especially with all these masks and face shields and everything that we have on. So sitting in front of them face to face, speaking slowly, you may have to repeat some things if they don't catch it the first time. It helps with yeah, it just helps them understand and see it better. So sitting face to face, being patient, speaking slowly, just taking the time to do the conversation, getting to know them, doing their medical history, getting all the information out before you start laying them back and getting started on your work, I think helps a lot with the conversation.
Do y'all talk to them about finances and treatment plans, or do y'all leave that for the office staff?
Office staff.
Okay. Yeah. Rachel, what about you?
I mean, obviously, I'm trying to help make sure that they're going to follow through with whatever treatment is recommended, because the doctor won't recommend it if it's not something they need. And so
Mhm.
I'll ask them if they have any concerns about the treatment once the doctor has left the room. And if they bring up finances to me, then at least I'll either tell them the options that we have available in that practice, or I'll look for, being knowledgeable about where there's free or reduced care in my area. Um,
Yeah.
because there are some places that might do like once a month free extractions. If they say, yeah, I've got all these broken teeth, but there's no way I can afford it, I'll try to let them know where that is, because I still think, I mean, that's the ethical thing to do. Of course, the practice wants the business, but the ethical thing is to tell them where they can get the help they need if they can't do it with us. So,
Yeah.
Points.
Yeah. Sometimes, I mean, I'm a jokester, I guess, but I always, and I love doing it with my older patients too. Whenever somebody says how much is something, my answer is the same no matter what they ask. It's under $1 million, and
oh,
I like making everyone laugh. But I feel like the older people, they get a kick out of that. I feel like people take them so
yeah.
seriously, or they're scared to talk to them like they're real people just because of their age. And it's okay to make a dental visit fun. So, Melanie, you mentioned that you do mobile hygiene. How do they find you? How do your patients find you?
Sometimes it's through word of mouth, through the dental hygiene associations. It's through so also through dentists. Or if a dentist has a patient who just can't come into the dental office as often, they'll call me in as well. So there's a lot of networking and the dental community that they can find me through.
Can I throw in there? I was looking up some stuff, and there's something called Texas Mission of Mercy, and it is a mobile unit in Texas that helps with like free or reduced cleanings, fillings, and extractions. I think, and they travel around to different cities so people can look for them online.
Oh, awesome!
I
Yeah.
love that. I know I took my Western Regional boards in Oregon, and there was a mobile dental van, and I know they were doing extractions and emergencies and things for low income patients or patients without insurance that couldn't afford it.
Yes,
Hmm.
So
do it too. The dental schools and yeah,
yeah,
as well.
yeah. Yeah. And, Rachel, like you said, just knowing where those places are around you is so helpful because, hopefully everybody wants what's best for all of the patients. Especially the seniors, like you said, they deserve so much respect. So everybody does, but I feel like sometimes they don't get it.
Yes.
Yes, and I think a lot of dental offices really are kind of an island unto themselves, where they don't really look at what other options are out there. Like there's the what are the federally qualified health centers. So they're like community health centers that can also do dentistry for low income individuals. And I know I went to hygiene school in Massachusetts and did an internship at a community health clinic like that, and they saw a lot of elderly patients there. So I guess it's just something you kind of got to Google. You can Google it in your practice and try to help your patients be able to find it.
Yeah. Yeah. So what are some common issues that y'all see seniors coming in with? Like commonly, I know, a lot of dry mouth caused by medications and systemic illnesses. What other specific things that do y'all see the seniors coming in with?
A lot of them have dexterity issues, arthritis, osteoporosis. So it's really hard for them to keep their teeth clean. The ones that live in a facility, sometimes they don't always have access to a toothbrush, or the nurses, they have a nurse to help them, brush their teeth. So a lot of times, a misconception is that, seniors or older people, they don't care about their teeth. But that's actually the opposite, where they really care about their teeth because, they might be missing a teeth or have a partial denture, and they wish that they had taken their care of their teeth before. So now they're trying to take care of what they have left over, and they really want to get their teeth clean. They really want to take care of their teeth, but they don't have access to it, or they don't have the dexterity for it, or they don't have the transportation to go to the dental office. So, they really do cherish their teeth, and they do want to get that done. So having some kind of electric toothbrush, or teaching the caregiver how to take care of their teeth, or a family member, really makes a difference to with their oral health, and the patients appreciate it so much.
For years, one of the things that I always recommend to patients with dexterity problems or elderly that, can't grip, I always recommend kid toothbrushes just because they're chunkier for that dexterity. That's a big thing. Just so many they drink a lot of sports drinks and they feel like that's healthier, and just educating them, and not talking down to them or speaking down to them, but educating them on why water is so much more important, and stay away from sugar to keep all of your teeth, if whatever you have.
I see a lot of recession too in the elderly because they've had more years to brush their teeth and their skin is
Right.
thinner. So we talk about ways to not increase that recession. And then we also see denture issues where they might be rubbing and they just feel bad, like they've bothered the dentist so many times about how this denture doesn't fit, but they don't want to keep calling and being a pain. And we have to remind them, like, hey, this is our job. If you don't wear your denture, we don't want you just gumming everything. We want you to be able to chew. That was the point of you coming in and spending this money to buy this denture. So, encouraging them to come in and bring that denture or partial every time, whether or not they're wearing it, so that we can make adjustments so they will wear it.
So sore spots on from dentures, it can lead to so many more things. And a concern that I have, if their dentures aren't fitting right, or their teeth are hurting, or they're having issues, they don't want to eat. And especially at their age, they need to get a lot of nutrient dense food, and it makes it so much more difficult. So yeah, I love that, stressing the importance of coming in when something is bothering you. The sooner the better, so it can heal faster and you can get back to normal chewing.
Yes.
And not sleeping with it, because some of them don't know that
Yes.
either, or they don't want their spouse to know that they wear a denture. And so I'm like, how do they not know? But okay, so they sleep with it in, and then they come in and their gums are all puffy and red, and we talk about, hey, do you ever take it out just to let it breathe? Even if you take it out for a few hours during the day, that's better than nothing. So
Yes, absolutely. Absolutely. I see that a lot too.
Yeah.
I bet
And
you do in your home.
I've talked to patients and caregivers, like when they go from wearing it 24/7 to not wearing it, not wearing it at night or anything. Just I tell them, and I don't know if y'all agree with this. I tell them to wet a washcloth and put it over their finger just to massage
Hmm.
the areas, like just to get some blood circulating in there. Not blood, but just to move things around and heal it faster, just to massage it.
Yeah.
So, any other preventative tips for seniors that y'all can think of?
For as far as flossing, a lot of them have struggled to hold floss, on their fingers. So I either recommend that little, I guess it's a floss handle. It's a long handle that looks like a toothbrush with the little
Mhm.
U-shaped thing that can pop on and off. They can use those, or of course a water flosser. Of course I'm going to recommend Burst's water flosser. That's what I use, but I think that can be great and way more gentle on their gums.
Sometimes I'll suggest to like do the proxy brushes and soft picks while they're watching TV to get all that
Yes,
they eat. So many
yes.
fun for them to do it.
Yep. When I was in hygiene school, my dad, like he always brushed in the morning and at night, but for some reason, I think he started it when I was in hygiene school. He flosses after he eats lunch. Brushes morning, brushes night. I'm like, I don't care when you do it, as long as you're doing it. And he has go-betweens and proxy brushes. And so yeah, while you're watching TV, I feel like, especially as the weather gets hotter, especially here in Texas, people stay inside a lot more. So if they're watching TV, that's an easy place to do it, and you don't need a mirror. They know where their teeth are.
That's right.
All right. Well, guys, we can sit and chat for days, but I just want to thank y'all both so much for talking to us for about a very important demographic in all of our communities. Lots of great things that y'all shared and that we talked about, and I really enjoyed it. And so, yeah, thanks again for everything, and y'all have a great day.
Thank you.
Thank you. Bye.